The only person I know who could manage pain without medication was Rambo or Arnie, but none of us are Rambo or Arnie. Let's talk about pain and how to manage it without medication. So chronic pain is different to acute pain. Acute pain arises in response to a stimulus. You stub your toe, you hit your back, something like that causes an acute response in the body. Chronic pain lasts for weeks, months, and even years after the painful stimulus has resolved. This has become a disruption in the neural pathways and results in sometimes life-changing and life-limiting problems for the patient. So why does this happen, and how can we manage it without being on pills and potions for the rest of your life? As I mentioned, there's a disruption in the neural pathways, and our perception of pain has changed such that it now becomes a persistent and prolonged problem, and the person experiences that discomfort or pain even when there is no stimulus to cause it. So how can we try and manage this without medication? There are several techniques that I'd like to discuss with you today and see if these can help you deal with your chronic pain. So the mind and the body have an intimate and complicated relationship, and this is something that we can use to our benefit to try and help manage the pain. Sometimes things such as simple relaxation and meditation often have profound effects on how the body experiences and perceives pain. So simple things like deep breathing, relaxation, mindfulness have been shown in studies to decrease the perception and then the experience of pain. Another method that we can employ is exercise. Yes, that's right, exercise. You may think, well, I'm in pain, how can I exercise? But moderate, low intensity exercise can often be very beneficial. So for example, if you have achy joints, movement can increase flexibility, and then you move the joint, it becomes less stiff and less painful. Or low resistance, non-impact exercise, for example, swimming or yoga. These can also have massive benefits in helping manage chronic pain. If you're struggling, you can see a physiotherapist and they can give you guided exercises with a structured regime for your particular problem. And they can often also employ techniques like ultrasound and manipulation to help manage your pain. Now, another technique, which I've said before and I'll say again and I'll keep on saying, is your diet and lifestyle. Nutritious food, whole food, avoid ultra-processed food, whole food, lean proteins, fruit and veg, fiber. All of these have manifold benefits in a whole host of medical problems, but also in chronic pain. Eat well and be well. That'll help you massively. So some examples are leafy green vegetables, lean proteins like chicken and fish, and berries. All of these have strong evidence behind them to help you manage chronic pain. All of these have strong evidence behind them to help manage chronic inflammation and then subsequently chronic pain. Alternative therapies, what does that mean? Well, I've talked about physiotherapy, but there are other therapies, for example, massage, acupuncture, chiropractic. There's something called TENS, which is a small electrical current passed through wires. You apply little patches to your body, and that provides a current and often helps with chronic inflammation and pain. So there are these other options that are available, and if you are feeling you're fed up with medication, try these or ask your doctor to prescribe these for you. The next one I'm going to talk about may sound weird, but CBT, cognitive behavioral therapy. Normally this is reserved for things like depression, anxiety, and mental health problems, but there is a strong link between inflammation and anxiety, and I've made a video about this in the past. Please do check it out. So inflammation and anxiety are strongly linked, and if you can employ techniques such as CBT, this may help decrease inflammation and consequently help deal with some of your chronic pain. Now, I mentioned your diet and nutrition. There are other lifestyle changes that you can employ. For example, journaling, reflection, noting things down, keeping a diary of your pain. And what you may find is that once you keep a physical diary, you notice that actually my pain is worse in the mornings. I need to do my exercise in the mornings, or late at night after I've been moving around all day, I find the pain and inflammation worse. So chronicling your episodes of pain gives you an objective measure, and then you can employ techniques to help try and manage it. Having said all of that, if you do find that your pain is still really hard to manage, then of course, it doesn't mean you shouldn't take painkillers. There are painkillers that are available, simple painkillers, paracetamol, Nurofen, then stronger painkillers like codeine and so on and so forth. And then if you're really struggling, see your doctor. They may prescribe medication for you to try and help manage your situation. And going even further, you can be referred to something called the pain clinic, where there's specialists who deal solely in managing chronic and difficult cases of pain. You don't have to struggle alone. Reach out to me, seek help and advice, and get assistance with managing this problem. If there are any other topics that you'd like me to discuss, let me know in the comments below. And remember guys, true wealth is health.